Hello, my name is Ivy. I'm a fourth-year social work student at Toronto Metropolitan University. I am currently completing my placement with the Organization for a Safer Space. Today, I will be talking about agoraphobia. In this video, we'll first look at what agoraphobia is. We'll then look at some statistics, risk factors, symptoms, effects, treatment, and lastly, we'll look at some coping strategies. Agoraphobia is an anxiety disorder characterized by the avoidance of situations or places due to an excessive fear of being overwhelmed by anxiety or being unable to escape or get help. As a result, people with agoraphobia avoid open spaces such as parking lots or enclosed spaces such as movie theaters, crowds, places outside of home, and public transportation. Agoraphobia can co-occur with people who experience panic disorder. Some people with agoraphobia have a fixed route or territory. Thus, it can be extremely difficult for them to move beyond their safety zones without experiencing extreme anxiety. Statistics. In the United States, approximately 1% to 2% of adults have agoraphobia, while around 2% of adolescents suffer from it. People are usually diagnosed before the age of 35. The lifetime prevalence for the United States population is around 2%. Women are twice as likely more to experience agoraphobia than men. Risk factors. The risk factors for agoraphobia include a personal history of panic attacks, a personal history of other mental health conditions such as depression, a family history of agoraphobia, being anxious or nervous by nature, experiencing excessive fear and apprehension in response to panic attacks, a traumatic childhood experience such as death of a family or friend or abuse, a distressing life event such as divorce or job loss, alcohol or drug misuse, being in an unhappy or controlling relationship, phobias or intense fears, such as the fear of crime, terrorism, catching an illness, or being involved in an accident if leaving home. Symptoms. Agoraphobia can cause severe fear and stress, leading to the avoidance of situations. To be diagnosed with agoraphobia, one must experience excessive fear or panic, one in the middle of at least two of the following situations or places: an open space, an enclosed space such as a small shop, public transportation, a line or crowd, and outside of home alone. People with agoraphobia can also experience physical symptoms similar to those of a panic attack when they are in the middle of a situation or place that causes anxiety. The physical symptoms can include rapid heartbeat, rapid breathing, chest pain, sweating, upset stomach, trembling, dizziness, difficulty swallowing, diarrhea, and ringing in the ears. Effects. If left untreated, agoraphobia can lead to other conditions such as depression, alcohol or drug abuse, be completely homebound, and be dependent on others for outdoor needs. Treatment. Agoraphobia can be treated with a combination of therapy and medication. A common form of therapy is cognitive behavioral therapy, or CBT. CBT helps a person break the cycle of negative thought and behavioral patterns and learn positive and healthier ways to think and act. Cognitive behavioral therapy can be used in combination with exposure therapy, in which a mental health professional can help a patient set goals to confront feared situations or places, including going to a nearby corner store. Another treatment is applied relaxation, which teaches people how to relax. Applied relaxation involves methods that educate people on how to identify signs and feelings of tension, relax muscles to relieve tension, and utilize techniques in stressful or daily situations. Medications may also be prescribed by a mental health professional, including selective serotonin reuptake inhibitors, which help to treat anxiety. Coping strategies. There are several strategies to cope with agoraphobia, including decreasing or avoiding the intake of caffeine, alcohol, and drugs, as they can worsen the symptoms in the long term. Eating healthy, as a balanced diet can help with overall health. Exercising regularly to alleviate stress, tension, and enhance mood. Educating oneself about agoraphobia and panic attacks to better control symptoms. Using breathing techniques, including breathing deeply and slowly to relieve stress. Practicing creative visualization by resisting negative thoughts and instead focusing on a place or situation that induces peacefulness. If you have any of the symptoms described in this video and they impact your daily life, it is important to seek help. Feel free to check out the Organization for a Safer Space at forasaferspace.org, where you can have access to accessible, affordable, and affirming mental health care with licensed mental health professionals. Thank you for watching and have a great day.